Well, good morning, and thank you all for being here on this momentous day. Very exciting. I'm Scott Elner, CEO of Billings Clinic, and I'd like to welcome Governor Gianforte and his wife Susan, and Charlie Barrington from DPHHS. This is something very much needed for our patients in Montana. And the ability to communicate effectively through different means, whether it's the electronic health record, will actually have an impact on saving lives. I was talking to Ben. He said that we'll be able to now actually see images, whether it's X-ray, CT scans, MRIs, or that we can pull up through the Big Sky Care Connect, which is just outstanding. Having the communication amongst healthcare providers is going to be instrumental. And we're so excited for this kickoff. And I'm going to turn it over to Ben Terrell, from the CEO of Big Sky Care Connect, and he'll do a run of show.
Thank you very much. Good morning. Thank you all for joining us today for this very exciting announcement. First, we'd like to thank Dr. Elner and his team here at Billings Clinic for graciously hosting our event for the second time. We had this planned about a month ago, and for some reason, every time we plan this event, it decides to snow. But thankfully, we're able to get through today. Thank you also to Governor Gianforte and his team for their support towards this critical concept and helping us make this become a reality. I'd like to recognize some guests we have here with us today. Jean Branscombe from our board of directors, leaders from Billings Clinic and Intermountain Health who joined us to celebrate this announcement. Big Sky Care Connect has been building towards this day for several years. A dedicated group of leaders from across our state, from healthcare providers, key members of the Department of Public Health and Human Services, commercial payers, the business community, patient representatives, have helped guide us to reach this critical juncture. We're very proud that Montana now has a secure and comprehensive platform to support providers across our state to enhance the delivery of clinical care in communities throughout Montana. We are committed to developing and implementing a technology platform that enhances the patient experience, improves the provider experience, reduces the cost of healthcare, and improves the health of all Montanans. Since our first live connection in December of 2020, we have continued to build and grow our network of contributing partners, and we now have more than 200 provider locations across the state who are contributing data to our repository, including Montana Medicaid. We're excited to continue to develop our services, including the image exchange program, as Dr. Elner mentioned, as well as the development and implementation of a statewide antibiotic resistance information exchange in partnership with the State Department of Public Health. Our partnership with the state and the team at DPHHS has led us to this exciting announcement from Governor Gianforte coming up next. After that, we'll have a chance to hear from Dr. Steve Arbergast from Billings Clinic and see a demonstration of how our platform is impacting his ability to deliver care. We'll then hear from our panel on how this platform can benefit their organizations and their patients and where they see the possibilities in the future. As our platform continues to grow, the continued growth of participation from provider organizations and other stakeholders across the state is critical. This platform works to benefit everyone when everyone is participating and contributing. Our hope is that the message today from our organization, from the governor, from our current partners, is now is the time for those who have not engaged yet to begin that process and become an active partner in this critical platform to support the health of all Montanans. Governor?
Thank you, Ben, and thank you everyone for being here. I want to say a special thanks to Billings Clinic and Dr. Elner and your whole team for hosting us. You've really all been fantastic partners in helping us strengthen our healthcare system. And I also appreciate all the industry leaders that are here from across the state. So it's great to be here for this announcement. The last time I was here at the clinic, I had the pleasure of announcing our Care in Montana program to address Montana's longstanding healthcare workforce shortage. It's working, but there's more we need to do. The program's off to a successful start. We look forward to welcoming more outstanding doctors and other healthcare providers to Montana to serve in our communities and enjoy our way of life. As we work to build our workforce, we know these professionals can only be successful as the tools that we give them and that's really the focus today. Today I'm pleased to announce a $20 million investment in the state's Health Information Exchange through Big Sky Care Connect. This is going to help us get more people connected and expand the impact of this program. Just for everyone's knowledge, those in the medical profession understand this, but this platform allows doctors, nurses, pharmacists, and other healthcare providers to appropriately access and securely share a patient's medical information electronically. This means no matter where an individual is seeking treatment in Montana, providers can access the patient's health information. As the industry leaders in this room can attest, the ability to have quick and secure access to medical records, regardless of location, is vital, especially in emergency situations where time is truly of the essence. Our investment will not only make the industry more efficient and save taxpayer dollars, but it will save lives. Over 75 medical provider organizations and more than half of Montana hospital systems already signed on as Big Sky Care Connect, encompassing more than 350 provider locations across the state. So, Ben, you're already having tremendous impact, and this will allow us to take it to the next level. Currently, BSCC is working with an additional 40 providers to connect them to the platform. All of us here would agree the more providers we have on board, the better the outcomes will be for all Montanans. And that's what we'll continue to work towards. So with that, I'll turn it back over to Ben.
So Dr. Arbergast is going to walk us through kind of his utilization of our platform in his practice and how that's supporting his care and care for his patients. Thank you.
Does someone have the mouse to control the slide, or somebody control the slide for me? Thank you so much. I'm Dr. Steve Arbergast. I'm a neurologist here at the Billings Clinic. I've been practicing back in Montana for about 13 years now. I've had a few different roles here at the Billings Clinic, but now I like to consider myself just a rural Montana brain doctor. And so as part of that role, I actually have the opportunity to serve people from our region, which includes most of the state of Montana for some very specialized clinics that we operate at the Billings Clinic, as well as a large region in northern Montana, and even sometimes the Dakotas, and occasionally even people from Idaho. Because of my role, I serve patients here at the Billings Clinic, I serve patients at Livingston Healthcare, and I also have the opportunity to go to Advanced Healthcare Montana, the long-term acute care hospital. And each of those healthcare delivery places serves patients from a huge region. Livingston's a little bit more smaller, but Advanced Care Hospital, we bring in patients from Idaho, the Dakotas, Montana, Wyoming, and these are the sickest of the sick. In the Billings Clinic, as part of my specialty care services, as well as general neurology services, I see patients from the same geographic area. And this is true for all healthcare providers in the state of Montana. The patients have to travel extreme distances through a variety of weather conditions, and sometimes they come to see some of the specialists at some of the bigger hospitals, or sometimes they go back to their primary care providers in the smaller communities. And some of the barriers to care, as everyone can imagine in this room, is traveling with that information, keeping that information with the patient, and easy and effective access to information. And that's one of the things that I found as I've been able to use Big Sky Care Connect, that we've been able to actually have better, quicker, more efficient access to information, allowing us to give better care, more cost-effective care, and more efficient care than I was able to do prior to this. So to that end, I'm going to give a story about Mr. Jones here. Mr. Jones was a 50-year-old male who recently moved to Montana, about 6 months prior to me having the opportunity to meet him. And he had moved here and lived in one of the rural communities over between Joliet and Red Lodge. He had actually already been established, now I know this, at the Riverstone Health Clinic in Joliet. But one day, last fall, he began to develop breathing issues and went to the Joliet Health Clinic. They assessed him and found him to be very sick. His oxygen levels were very low, and they rapidly transferred him down to the Beartooth Billings Clinic emergency department. There, they found him to have a positive COVID test, but he was declining clinically and not doing very well. So, emergently, they flew him to St. Vincent's Healthcare. Billings Clinic was full, as we all dealt with that last fall. And so he went to St. B's. So within a matter of 2 hours, he'd been through 3 independent healthcare systems, and records don't follow you that quickly in the medical world. This is still a paper world in a lot of ways. And so he got admitted to St. B's Healthcare. Unfortunately, he required long-term intubation, couldn't talk, couldn't give histories. His records never really did follow him from the Riverstone system. And eventually, after a couple of weeks at the St. Vincent's Healthcare, where he received wonderful care, he was eventually transferred to Advanced Care Hospital of Montana for long-term respiratory management and recovery. He did start recovering there, but required aggressive care, and after a day or two, suddenly had an epileptic seizure. He actually had a couple of them. I was able to come and assess him there, and fortunately treat those and stop him from having a seizure. Now, unfortunately, he still had ventilatory support and couldn't give us any further history, and I was kind of at a loss what to do. Normally, when we have a patient who has a seizure, this requires emergent brain imaging, possibly emergent EEGs, which is a brainwave test that we order, and oftentimes specialized lab workup. At Advanced Care Hospital, they don't have access to that emergent imaging, and so usually the treatment plan is a very expensive transportation out of one hospital to another hospital, and then imaging, lab testing, further workup, more doctors, and it gets very complicated. So what I try to do, the next slide, is I do have access to St. Vincent's or Intermountain Health record system, and I reviewed that, and I couldn't find really anything in the record system outside of the acute hospitalization from the couple of weeks before. So I had also, and then eventually I also logged into the Billings Clinic system, hoping that something from Beartooth Billings Clinic would be in the system. But again, everything was so acute with that, we really didn't have much in the way of accurate medical records or any sort of detailed explanation. And I didn't have easy access to the Riverstone records. But already I've spent a lot of time logging in and out of different health systems, trying to review records, and it becomes very frustrating as a provider because eventually I just say, okay, let's transfer the patient over and get them taken care of. But in this situation, it does sound a little bit cheesy, but where else should I go? I was actually able to go to Big Sky Care Connect, and this is the situation where it was actually quite helpful. So I'm not going to go over these slides yet, Jeannie, okay. But what I was able to do is log into Big Sky Care Connect, and I was able to find records about this patient's medication refills, which was not easily accessible through a lot of the other views that I had. And I quickly found that this patient had been on an anti-epileptic drug for as long as he'd been in Montana. And so this changes the entire scenario for this very acute emergent situation from an emergent situation to something that is more of a chronic medical condition with a single exacerbation. And so I was able to restart this patient on his appropriate medications. We didn't have to transfer him out of the hospital. We didn't have to get very expensive laboratory and imaging studies. We didn't have to do anything else. We treated the patient, and fortunately, he actually made a wonderful recovery and was able to go back home. And we restarted the medications, and he had no further seizures. And so this saved cost, it saved time, and it treated the patient better than had he been treated previously, which is fantastic. And Big Sky Care Connect really did help this patient significantly with this simple access. So just as a brief demonstration, we were going to give some slides about how easy this system is to use. And it still is in my day-to-day practice. I log into it 2 to 3 days a week, even now, looking to see what's in there for the patients that I'm seeing from around our region when I have the opportunity to treat them. So there's a very simple login screen that you get set up with as a provider here. And it gets you into a search screen that allows you to search for pretty much everybody in the state of Montana. The search algorithm is really, really efficient in my mind. I can put in a patient's name and it will pull up that patient along with other patients with similar names. It gives you a match hierarchy, gives you date of birth, and so you can really dig into the appropriate patient's chart really quickly and really effectively and without having to be inundated with 50 John Does. You can find the patient that you want to find immediately, which is very nice. In that, the very first splash screen that you get into is this quick overview of the patient's overall activity of what's been going on lately. This includes things like medications, what some of their diagnoses are, quick access to a variety of things that have happened in the past couple of months and what's in the system right away. Now, if you want to dig deeper, this is where this is fantastic. Within 1 or 2 clicks, you can get into things like clinical documents. So I can see clinical notes and progress notes from a variety of healthcare systems, and that's continuing to expand the access. And so I don't have to ask my front desk staff in my office to call and ask for someone to fax a record that may or may not ever occur. The records are just there for me to review appropriately and quickly be able to treat patient care. We can see lab results. So I don't have to repeat lab results. If a patient's seen in Harlowtown or other place, I don't have to repeat the labs that were done because I can see that they were just done 2 weeks ago. And again, saving time, efficiency, and money, and allows me to make decisions quickly as a clinician. I see the vital signs, so if their blood pressure is a little bit elevated in my clinic, I can look to see, have they had this chronically? Is this something I need to be worried about or not? I can see things like immunizations. As a neurologist, I'm not quite as concerned with immunizations, but it is nice to have that record in front of me so I can see what we're dealing with, and we keep that all up to date in a single place. Next slide, please. And as I laid out, you can also dig much more deeper. You can actually see, I think, every prescription that's been written through the Doctor First database that's on there. And this is great because this includes, as I understand it, healthcare claims from insurance, Medicaid, pharmacy repositories, as well as physicians' offices. And so we really get an idea of what medications they've been on. That's always a challenge for all healthcare providers, is knowing which medications patients are currently taking. Sometimes people are really able to give us a detailed history, and oftentimes they're not really sure what they've been on or what they're currently on. Having access to that information quickly and easily allows us to better treat the patient, without a doubt. Next slide. And then also, this also allows for Medicaid eligibility data, which I think is a new thing that's been added recently, which is quite another huge database of information that, as this continues to be combined into the overall Big Sky Care Connect, allows just for better care and treatment of our patients. And there's also an easy way for hospitals and staff, or I suppose myself as well, to be able to send a quick summary of much of this information to people through the Big Sky Care Connect secure email system. And this includes things like medications and problems and a variety of other medical diagnoses to give a quick heads up to people that may not have the opportunity to look at this immediately. And so that's a very nice clinical care document that's available immediately through this system. And it's probably more comprehensive than what most of the individual healthcare systems can offer based upon the fact that it's got information from everywhere in the state. Next slide. And that's my little spiel. Thank you.
Thank you. So if you wouldn't mind sharing the microphone as we go down and start going through some of our panelists here and get their feedback. I know Dr. Rudolph from Intermountain Health has been an active leader in this project with their organization, as well as a long history with prior attempts to get this project and projects like this off the ground. I'd love to kind of get your feedback and input as to how you're seeing this develop now and where it can go in the future.
Yeah, so thank you. Thanks for the opportunity to be here, and thank you, Governor, for joining us today. So my role at St. Guy's, I'm an internist and lead the diabetes center there at St. Guy's. So similarly, specialty care, so I get patients from a large catchment area, multiple states. I also have another hat where I lead the inpatient and outpatient Epic electronic medical record, and have been involved in this HIE project. This is actually, I think, my third HIE project in the state of Montana. Since joining here, I've been here now for 15 years back in Montana. So I've seen multiple iterations of the HIE, multiple attempts, and I think we've always had this kind of vision and kind of that holy grail of, boy, if we could just get this information combined and together, it would improve efficiency for our patients and for us clinicians, save on costs, but it just couldn't quite get to a critical mass where enough organizations were on board that your data set was just too limited. And we had the project previously with the Billings Clinic and Riverstone and St. Guy's, along with insurance with Blue Cross Blue Shield of Montana, and really kind of got that momentum going, but just never quite could cross that finish line. And so under Ben's leadership, it's been really helpful to finally kind of get to that point of getting multiple organizations across the state on board and continuing to feed data to the system. And the reality is, the more data and the more healthcare organizations that sign on, the better our infrastructure and data set's going to be. And so, again, kind of, Ben, I reflect to your thoughts of we just need more institutions signing in and committing data to the system. There's similar to Dr. Arbergast is, I have patients from Northeast Montana and Southwest Montana, and a patient a couple of weeks ago, it's like, okay, had some procedures done in Great Falls, and it's like, okay, what were those? He's not quite sure. Were the meds changed? And so I think being able to log in quickly to the Big Sky Care Connect is really helpful. And at St. B's, we instituted kind of a single sign-on. So right from our EMR, we can drop down into the Big Sky Care Connect connection and quickly pull out that patient and review their history. So we don't even have to log out of our current electronic system to get to that portal. So again, it makes that care even more efficient. And so I think the progression has been great. I think we're at a point where this is going to be a platform that's stable, and we have the technology and infrastructure behind it to continue to move forward. So it's been a pleasure to work with and finally kind of see that come to full fruition. And I think there's great things to come as a result.
And Lynette from Rimrock Foundation.
Thanks again for including behavioral health in such an important initiative. Both mental health and substance use disorders part of your overall health. And one thing we've known for a long time is we have to be a partner in this, and this is such a great platform for us to be able to share the information. If one thing really came apparent during the pandemic is we knew we had some cracks in our system. But the pandemic showed us that we actually had crevices, and a lot of people fell through them. A lot of people would seek out care first through an emergency room when they were actually in a mental health crisis. And to be able to have this kind of information immediately readily available and then referring to a more appropriate level of care to be cared for has just been immeasurable. Often too at Rimrock, we might have people that are so compromised physically that we need the resources of a higher level of care at one of the hospitals. And so in turn, we also refer there when they are in a physical crisis. And to be able to then share the information and how they're doing in the recovery has just been an unbelievable change. So incredible, great work. And I've been around for a long time. I'm a registered nurse, and I remember in the olden days when I was taking care of people, they'd be coming in with some gallbladder disease, but you look at their secondary and their tertiary diagnosis, and you often saw severe depression or alcoholism. And even back then, I did not understand how the full body component worked together to have wellness. It's no different than all of us working all together, so we're hitting on all the same cylinders so people get the care that they need. So I've been very appreciative, and I'm glad to be partners with all these folks here in the room.
Dr. Thompson.
Good morning. So first of all, I want to thank the governor for his ongoing support and his current investment in Big Sky Care Connect. And you're probably getting asked, why are we investing this precious money of Montana into this HIE? And the answer is pretty simple, because this directly improves health, safety, and our patient experience. Before Big Sky Care Connect, we had no access to data. We couldn't quickly or easily get the information that we needed on our patients. And as an emergency physician, I could take care of a patient who just walked out of St. Vincent's, walked down the street, fell, they hit their head, and they're unconscious. And now I have to take care of them. And I had no access to their medications, their history, and I had to repeat everything because we just couldn't get the information. So I could look up the street and see the facility, but I had no access to their data. Same thing with Riverstone. Same town, same setup, we can't access their information. And patients are often frustrated because every time they go to the doctor, they go to a new provider, they have to present the same information over and over and over and over again. And they say, well, I already told Dr. X, don't you have that information? Well, now we do. And so that's a good patient experience. Afterwards, providers and professionals now have immediate access to this information. We can get it quickly, easily, safely, and securely. So we share that information about patients. We enhance the patient safety, as Steve alluded to, with this Doctor First. And that's important because we often write prescriptions for patients, but about half of them fill their prescriptions, half of them don't. So if we're trying to make an adjustment to a medication they're not taking, it's very difficult. So we know the medications they actually took and got filled and which ones they didn't. And we're gonna have the ability to see images through the image exchange program. And really exciting, we're gonna have access to our veterans and DoD, Department of Defense patients. We're gonna have access to that data very soon through that integration with eHealth Exchange. So this is a much better system now. So thank you for your support.
Aubrey from Advanced Care Hospital.
Thanks, Ben, and once again, Governor, thanks for joining us today. So Advanced Care Hospital in Montana, as Dr. Arbergast kind of talked about, is a long-term acute care hospital here located in Montana. And we are the only long-term acute care hospital in Montana, which means we serve patients throughout the entire state. As Dr. Arbergast said, we also serve patients from northern Wyoming, the Dakotas, as far away as Washington and Utah, just given the nature of what we do. So we're a hospital just like Billings Clinic and St. V's. The difference is we typically specialize in managing patients in that 2 to 6 week area of their medical care. So we take those complex patients that typically require ventilator weaning, wounds, complicated surgical histories, and our goal is to improve, receive training, and then go to the next level of care for these patients. Why the HIE has been so very important, and I'm just going to mirror what Dr. Arbergast has said, is it gives us the ability to see where these patients have been. Many of these patients in Montana, especially in the rural areas, really focus on getting care in their communities and in their region. And when we get them, we don't have access to those EMRs, or many times, as Dr. Arbergast said, paper charting. So the HIE, the benefit that we have seen in Advanced Care Hospital of Montana is we have been able to capture some of that data and see some of that history to be able to provide that very efficient, that very safe, and ultimately put together a plan of care that will get these patients to their next level of care in a better position without knowing all of those items. So the biggest thing that Advanced Care Hospital and all of the healthcare providers in Montana could see going forward is that increased participation by even really anybody, but especially some of those smaller area community healthcare centers, because that is where a lot of our patients come, especially in this region. Having that information available to us through the HIE creates efficiencies in providing that plan of care and ultimately setting that patient up for the best possible outcome and the best possible discharge that they can get. The other things that we can, what I would like to see going forward, and that we sometimes see in advanced care, is patients are hesitant to share their information through the HIE. So ensuring that we have better patient education on why this is so important. I'm not trying to get information out of you for no reason. I'm trying to get this information so we can share it with our healthcare providers, share it with your healthcare provider, and ensure that ultimately you have a better outcome. So thank you.
Dr. Arzubi.
Thanks, Ben. So Ben owes me a real name card, but I'm actually, thank you. I'm actually here on behalf of Dr. Reza Gomi, who's our Chief Innovation Officer. He's on a well-deserved vacation, but I give him the credit for really working with Ben and his team to get us set up with the HIE. Actually, great timing. Overnight, we actually got access to the single sign-on in our EMR, and I checked it out this morning. It was great. I mean, I looked up a couple of sort of chronic mental health patients that we have, and was with one click of the button able to look at the history, which was wonderful. Just a quick background. So Frontier Psychiatry is an all-virtual practice. We focus on Montana exclusively, and our goal is to make psychiatric care available to all Montanans by 2025. And now we're seeing well over 100 patients a day, largest psychiatry group in the state. We're seeing folks in every county. And so being able to access patient records from these different organizations would be near impossible without something like this. And so being able to just one click of the button, I think a real game changer. And then the other piece we're working on with your team is, since we have patients all over the state, is we're gonna work on something where we get flagged if one of our patients ends up in the emergency room in a mental health crisis. And so we'll get a signal. In this way, we don't have to wait for that information to come, but we can actually start playing offense and hopefully improve outcomes and improve follow-up care in short order after being in the emergency room or being hospitalized. So I think this is potentially a game changer. So I appreciate what you're doing, Ben. Governor, thank you for investing in this, and thanks for letting me be on the panel. And thanks for the name tag.
This is what happens when we have snow and we have to be creative. Eric was very gracious in sitting in with us today and suffering through it. So I appreciate it. Do you have any questions, Governor, or anything you wanted to ask of the panel?
Well, this was very helpful. I appreciate the collaboration. One, you mentioned, Ben, we've made great progress in getting critical mass. And St. V's, Billings Clinic, advanced care. A lot of care in Montana is delivered through primary independent practices. I'd be interested in hearing from you about what are the obstacles for a small practice to get access to this?
So we have participants across the healthcare spectrum. So we have Billings Clinic, St. Vincent's Hospital, Logan Health, and Kalispell, large hospital systems participating. We also have single doctor practices that are participating. Barriers are on a couple of fronts. The first and foremost is knowledge and understanding. So I think there are still some fears, as Aubrey brought up, about sharing of information and how to do that securely, and that's been the primary focus for our build over the last 2 years, was to make sure we had a foundational technology and an infrastructure in place that was secure and that could provide that safety and construct to what we do. So helping to demonstrate and show people we have that in place. The second is having their electronic health record and their vendor partner be in a position to be able to meet those requirements. And we're seeing a lot of progress on that front to get people through. And then the final one is there is a cost component to it and a willingness from providers to invest forward in this, because the return is not immediate. It's an investment in the future of what we're going to build and how we're able to support the state moving forward in the future. And understanding that it requires an investment today, so that the next time we need it, the next time someone shows up in their practice, we have that information going forward. Great. Any,
I just would like to comment on top of Dr. Thompson. I had an experience, you said, it might have been seen in the St. V's and then comes down the street, and I have no records. I was in the room with a patient and typing out my patient instructions and seeing it like in Big Sky Care Connect instantly. I'm like, that's in there already. And so it happens so quickly. And so I think some of that speed and efficiency is there, where, hey, patient's discharged, he's out of my office, my note's done, it's on there and it's available. So, good job.
Ben, can you elaborate on what does this mean for the patient, right? So I know we've talked about the importance of the kind of the user-facing experience. You guys have made great strides there. I'd love to hear from you on that.
The big focus for us, again, is sharing of information, so patients don't have to carry either information with them in their brains, and being able to accurately share, sometimes very complex histories that are difficult to remember or know when you talk about the medication history. My background on the provider side is in the long-term care industry, and so the number of patients that can keep track of the number of medications, the dosages of those medications, frequency of those medications is almost impossible to do. So having that record be available so that they don't have to have that with them, or in Dr. Arbergast's case, we have a patient who's not capable. that they're physically incapable of sharing that information, and the impact that has on their health, and the ability to avoid, we all know unnecessary testing is both costly, but it also has a negative impact and a risk for patients. So having to take a complex patient and send them out of a facility where they're receiving good care and are in a safe environment, and now having to leave that facility to go get a test done in another place, and even if that test isn't necessarily a risky procedure to do, the transport, the travel, it places that patient at additional risk. And then finally, the fact that our patients do travel across the state to receive care, and we have great rural health environments that can provide a level of care, but when they need subspecialty care, when they need higher levels of care, they're having to travel to the larger health systems, and getting that information to that health system and then back to their primary care setting and back to their home setting so they can maintain their life and maintain their health in a great place is really what we're focused on doing. For those in the media, if you'd like, we have a setup here. If you'd like to see a live demo of the system, we have the ability to, Jeanette from our team will be able to kind of walk that through with you and show you kind of how our system actually works. No live information available. So we have a nice training patient set up to be able to see that. But otherwise, really appreciate you all coming out and supporting this project and get the message out to folks that now's the time. We have that foundational technology. It has taken a lot of effort, a lot of leadership from people in this room and outside the room across the state to get us to this point. And now we need the rest to join on and to be a participant so we can continue to improve and impact the quality of life and quality of health for Montanans all across the state. So, thank you.